Welcome to the Migraine Miracle Moment. I'm your host, Dr. Josh Turknet. I'm a neurologist, migraine specialist, migraine sufferer, and author of the books The Migraine Miracle and Keto for Migraine. In this podcast, you'll learn all about how to find your path to migraine freedom. Let's get started. Okay, welcome again to the Migraine Miracle Moment. It is good to be back here. It's been a while since I last came to you, and it's been a busy year filled with multiple projects, including some work behind the scenes on an exciting new resource for people with migraines that we'll be telling you more about soon. But I'm back here on the podcast, and we'll be coming to you regularly again in 2025 and beyond, which I am really looking forward to, because there is so much work still to be done, and that is highlighted by the shocking study that I'm going to be sharing today. For those of you not watching, I put shocking in air quotes there, which we'll discuss in a minute. But this is a study I'm going to talk about, I think, that everyone with migraines needs to know about. And as I said, it came out a few months ago. So to set things up, as you may know, there are many medications out there for migraine these days. You have the medications that are given to relieve a migraine attack, which we refer to as the migraine abortives, and then ones given to try to prevent attacks, which we refer to as preventatives. And in the past 3 decades, numerous new drugs and devices have been approved for use for migraines. That includes the entire class of the triptan drugs, with sumatriptan being the first, which was approved in 1991. You have the CGRP inhibitors, which are more recent, as well as multiple different devices that are stimulators, essentially, of various kind. And then on top of that, you have more and more people getting treatment for migraines than ever before. So the proportion of people who are getting treated is higher. And there has been a push to ensure that more people with migraines are diagnosed, so that more people can be put on these therapies that are supposedly going to help them out a lot. On the surface, all of that gives the impression that there's been a lot of progress. And indeed, that's the story that's often told, that we have these newer and better treatments that are, better than ever. And oftentimes that's said in order to emphasize the importance of people getting diagnosed and treated. I won't dig into where a lot of that messaging is ultimately coming from, but I imagine you guys watching and listening have a pretty good idea. But those promotional efforts have worked. More people seek care for migraines than they used to. Awareness is up and medication use is up. So if you have more people than ever getting treatment, and if those treatments that we have now are better than ever, what should we expect to be happening with the overall burden of migraine? It should be going down, right? It should be going way down. We should be seeing far less suffering from migraines than we did 30 to 40 years ago, when the treatments were supposedly inferior and where less people with migraines were getting treated in the first place. So with that in mind, I want to tell you about the study that came out earlier this year. And it was published in the journal Headache. The title was Prevalence and Burden of Migraine in the United States, a Systematic Review. And what the study did, the authors did a systematic review of studies conducted in the United States addressing the prevalence, disability, or burden of migraine to see what the trends have been over the past couple of decades. And what did they find? First of all, they found that the overall prevalence of migraines has not changed. So that means that the proportion of people with the diagnosis of migraine in the population hasn't changed over that time span. Roughly 12 to 15% of the population has them, and women are roughly 3 times more likely than men to suffer from migraines. However, from 2005 to 2018, the proportion of people with moderate to severe disability from migraines doubled. It went from 22% to just over 43%. So the proportion of people with moderate to severe disability, which is assessed by how many days people are unable to perform their regular activities, that proportion has doubled in that time span. So in other words, people who have migraines are doing much worse than they were 2 decades ago. Now, as I said, according to the conventional narrative, we currently have more people than ever being treated with drugs that are supposedly better than ever. And if that were true, the rates of disability should be going way down, not way up. Now, when this study came out, people were acting like this was truly surprising and totally mysterious. Though any of you who've been listening to this podcast for any length of time are probably not shocked at all and understand exactly why this has happened and why it continues to happen. In fact, I've been waiting for this kind of study to be done because I knew what it would say. So what is going on here? How is this possible? Well, there are two main reasons, I think. First is that the preventative medications, by and large, don't work. When they do help, they are only temporary, so they may work for a few months and then they stop working. But the bigger issue is the tragic long-term consequences of the migraine abortive medications, which still remains significantly underappreciated or in some cases intentionally overlooked. Again, I don't know if other experts in this field were truly shocked by this result or what, but I certainly was not at all. Again, this is a predictable consequence of how we currently treat migraines. The specific problem is that in the short term, an abortive drug can help relieve a migraine, but in the long term, it makes them more likely to occur. And worse yet, the abortive medications typically become less and less effective over time at relieving a migraine. And so a very predictable thing happens, which is people end up taking more and more of them for two reasons. One, because they're not working as well, and two, because they're making future attacks more and more frequent. It's a vicious cycle that I was personally in for many years, and one that I saw over and over and over again in the clinic as a neurologist. This effect is more pronounced, unfortunately, with the migraine-specific medications, including the triptans, which are the most commonly prescribed abortives. So the tragedy there being the things that are the most effective are the worst at causing these long-term issues. And I ultimately realized that the way we were treating migraines was doing more harm than good by quite a wide margin, as these numbers illustrate. Now, let me be clear that most everyone here is trying to do the right thing and believing they're doing the right thing. Again, this is how I practiced for years, and I thought I was doing the right thing. But once I realized that this approach was causing more suffering than it was relieving, I couldn't do it any longer. And again, this study is clear evidence that this phenomenon is happening to migraineurs across the country. In many ways, this feels exactly like where we were in the opiate epidemic, where there was all this data staring us in the face that these drugs were causing far more pain than they were alleviating. And yet it took a mountain of evidence for things to finally change course. And the thing is, it does not have to be this way. It is entirely possible to use medications to help reduce the burden of migraine, but it has to be done with full awareness and consideration of their long-term consequences and drawbacks, with the goal being to choose one that has the highest chance of short-term benefit with the lowest chance of long-term harm. In addition to the most important thing, implementing a holistic program of lifestyle modifications for long-term prevention so that you greatly reduce or eliminate the need for abortive medications altogether. The part of all of this that is hardest for me is knowing just how much better things could be, that we have the knowledge and tools right now to greatly reduce the overall burden of migraine. Rather than doubling, it should be going way down. Unfortunately, there are still many forces presently that reinforce the status quo and lots of disincentives towards recognizing and acknowledging the full scope of the problem with the current approach to migraine treatment. And this highlights why it's so important for people with migraines to understand this issue. Clearly, most people in healthcare still don't, else you wouldn't be seeing numbers like this. And while I am skeptical that the changes that we need will come from within the system, from the top down, because of the incentive structures that are currently in place, I am hopeful that it will come from the bottom up, from more empowered patients like those of you who are listening, who serve as living proof that there's a much better alternative. and that it comes from not seeing migraine medications as the primary solution, but one small tool in a much bigger toolbox. Okay, that's it for this episode. If you guys know of other people who would benefit from this information, please share it with them. Also, if you're not already subscribed to our newsletter on Substack, you can do so through the link in the podcast description. All right, thanks so much for watching or listening. I'll be back soon with another episode. Now it's time to go out and slay the beast.